Go.
Hi, so I'm Antonio Carrillo, and today I'll be interviewing.
Joe Ben Watson.
And today he's gonna provide us with some insight about eating disorders and struggles with food. So, do you know anyone that has had any struggles with food or eating?
Yes.
And what are some ways that affected them?
As an everyday thing, they struggled with sleep. They struggled with having energy to do anything, focusing in class, ability to complete work. Really like all the day-to-day things that people do out of habit. You don't have to really think about doing. They had to really focus and make sure they did those things.
And if there are any, what are some ways that they were able to get through that, or things that helped them?
So we ended up referring them for some outside counseling, and they actually, I can't remember the name, but there was a place in Greenville that specialized in eating disorders, and they were able to get some, I think it was a brief period of inpatient treatment, and then they continued outpatient to provide counseling. I'm pretty sure they had a dietitian that they met with to plan out, making sure that they scheduled meals, making sure they were getting the right calories, the right nutrients. They helped them in a number of ways.
And if you know someone that's going through that, what is a way you can try and introduce going to a counseling or going through an external source for help?
The biggest thing is not being afraid to ask or have the conversation.
Mm-hmm.
Especially if you start to realize that they're starting to kind of reach out, or they're hinting at it, or if you can figure out that's what's going on. A lot of times you just got to come out and say things, and that helps with this stigma in the first place. Like, be willing to talk about it.
So if a student or someone knows someone that maybe a family member or friend or just an acquaintance that they know is sort of struggling through that, what are some ways that they can help, even if they don't know them personally?
If it's like a student situation,
Yeah.
I would say you could come to your counselor and just share your concerns. You can also, really any trusted adult as far as the school setting. If it's one of your teachers or it's a crew teacher, you can go to your parents if it's not necessarily school related, but sharing those concerns with a trusted adult, and then hopefully when you do that, the adult will, especially if it's like a counselor school, then they'll follow up with the student that you share the concerns about.
And what are some ways that River Bluff High School can help students with eating disorders and maybe just mental health as a whole?
Being willing to talk about it. The more we talk about it, the more the stigma breaks. And that's any everyday opportunity conversations that you have. We have a list of resources for counseling services that focus in different areas, different mental illnesses. But we have that at a district level that we provide to families. We have a referral source called Care Solace that I think all of our counselors have linked at the end of their email. But the counselor can put in the information for the referral, or families, if they want to do it more discreetly, I guess, they can just click the link and refer themselves. And that program is going to help you find a counselor that is in your service for your insurance. You get to say what exactly you're looking for, a specific area. They're going to find a counselor that focuses on that area, and they're going to make calls and set up meetings and have those conversations for you to take out some of that work. That service is free. The counseling part isn't, but that service being provided is free.
Yeah. And so, is there any advice you would give to someone that may be struggling with an eating disorder or just food in general?
In general, you're struggling with anything, be willing to reach out. It's very hard to do. I don't want to minimize it, but there is support, there's help out there, and people are more than willing to help you with whatever you need.
And just for you personally, how has your diet changed from just high school to you as an adult?
Don't eat as much fast food.
Mm-hmm.
I've realized how important it is to eat in general. I try now to eat something for breakfast, something for lunch, and something for dinner every day. I I know when I first started here, I was eating like Sour Patch Kids for lunch, and I didn't really eat lunch. I didn't really eat breakfast. But understanding how important a healthy diet is, and eating in general, like if you're not eating, how much it affects your mental well-being and your ability to function, like just the basic day-to-day things. So eat meals, and I try to eat more healthy, not fast food and vegetables, all that good stuff.
All right, perfect. Thank you. I appreciate it.
You're welcome.
And I appreciate you watching.